Before placing the electrodes of a graded exercise test, there are a few preparatory steps that have to be done. If you're a male like David, you need to come in and shave the chest. I'm not actually going to do that to my friend David here because he needs that. But the next move would be to take an alcohol swab to each site and wipe it gently. This is just a paper towel, but it's just to signify alcohol swab. Then we would come in with a Brillo pad or Scotch pad and rough up each area slightly. I'm just going to use the back of a sponge. This is just to get rid of the dead skin cells, just so the electrodes stick better. And after this, you would place each electrode and attach it securely, and then attach them to the machine. Placements for a non-exercise or resting ECG. Your right limb goes on the inside of the right wrist. Your left limb goes inside the left wrist. Your right limb or AVF goes in your inside of your left leg, and your ground goes inside of your right ankle. For your 6 chest leads, V1 sits on the 4th intercostal space on the right side of the sternum. Your V2 sits across on the 4th intercostal space on the left side of the sternum. Your V4 sits at the 5th intercostal space at your mid-clavicular line. Your V3 sits in between your V2 and V4. V5 sits at the left anterior axillary line on a horizontal plane with V4. V6 sits on the same horizontal plane, but at the mid-axillary line. Those are your leads for your resting ECG. After prepping the patient for an exercise electrocardiogram, these would be your lead placements. Your chest leads would be exactly the same as a resting, V1, 2, 3, 4, 5, and 6. The only difference being your limb leads would change, and they're changed to a more secure location because there's going to be a lot of movement during the test, and we want to make sure that they stay where they are. So we move your AVR to just under your clavicle and your infrasternal notch on the right side. Then we do your AVL in the same spot on your left side. And then your AVF is attached somewhere around the mid-rib region of your right side, or left side, excuse me. And then your ground is placed somewhere around the same area on your right side. And those are your 12 leads for an exercise electrocardiogram.